greater distance between the transmitter and receiver. So what we're looking for is similar to a functional MRI, which is the BOL response, which is the neurovascular coupling. So with increased neuronal activation, you have greater demand for oxygen and blood flow. And with this, we normally see this larger increase in oxyhemoglobin and a smaller decrease in deoxy because of the washout. However, the complexity of what NIRS is measuring in the bottom right is what we see in the NIRS signal. But what is the cause of this measurement are multifactorial. In this case, we have both metabolic changes, so how much oxygen is being consumed, the neurovascular coupling, as well as cerebral blood volume changes. So these all affect oxy and deoxy in slightly different ways. But essentially, it's a mix, and what we normally see is this larger increase in oxyhemoglobin and a smaller decrease in deoxy, representing neurovascular coupling. I like to show this slide because we did this combination of NIRS, fMRI, and EEG at the same time with help from our tDCS medical systems and their NIRS system, which allowed for MRI compatibility NIRS system. And what we see here is in the green is the BOL, which is the gold standard of neurovascular coupling measurements. And we see a finger tapping task, and we see these undulations in increase in bold with each block. So we have 10 blocks. And what we see nicely with the NIRS is these increase in oxyhemoglobin and a decrease in deoxy occurring for each block. So this shows that the NIRS is capable of measuring from cortical regions and has similar resolution to fMRI in this context. So how do we combine the two to provide better information on what's happening in the brain that can advise on clinical or performance metrics? So we started on just measuring on healthy. So we had a cap layout of 8 channels of NIRS on each hemisphere. These are denoted by the numbers, and we place the NIRS, the tDCS in a high definition. So in this case, an anode in the center and 4 cathodes surrounding. So that's the top right graph, figure. And we had, so you have NIRS probes both outside the high definition and inside on the left hemisphere of the brain. And of course we had on the opposite hemisphere as well to see how the brain reacts to different motor tasks in this case. So when you do a right-handed finger sequence task, so finger sequence like this, what we see is both left and right increase in activation. So as I showed before, increase in oxy, decrease in deoxy. And this is from the areas around the 4 channels. So you can see here, it's around the motor cortex region. So it's a larger response there. And on the opposite hemisphere, we see a smaller increase, so bilateral activation. So this can also be seen in real time. So the tDCS system provides this real-time measurements that you can see these changes occurring quite clearly. The other aspect that we were interested in is what happens during the simulation. And these changes on the bottom right panel actually are quite large changes, and we wanted to see what this represents. So this is around 2013-14 we did this work. Don't want to go too much in detail into this, but we also use another NIRS device that measures the absolute measurements of oxy and deoxyhemoglobin in Italy. And we showed that although the stimulation is affecting more superficial areas, we have a real brain activation occurring, which is the bottom right panel. This is also indicative of how we can use the near signal to determine the level of electrical field. So as I mentioned earlier, what we're trying to do is to get the current into the brain, and the barriers for the current to go in are the skull. So in some sense, how do we know how much current has gone in? And NIRS can provide a surrogate of this, as we've shown with this, the channels, the NIRS channels within the boundary of the stimulation provided a larger increase. So we would say that this would represent a higher current intensity. So we're working on developing a NIRS method to determine the level of intensity of the current actually going in, rather than what the device is saying how much is going in. So this would be a better indicator of personalizing stimulation, which is not currently provided in any system, any tDCS system in the world. So some mechanisms of how this works is you have the blood vessels on the surface of the cortex, and we have blood vessels deeper down, and we have the neuronal components that innervate it. So we have the sympathetic nervous system that innervate larger vessels from the outside, and we have internal neuronal systems like the locus coeruleus that modulate from the inside. So we could use NIRS in this context to determine which area of the brain, of the cortex, are being affected by the stimulation. This is some modeling work we did with a collaborator that showed where the stimulation is mainly affecting, and we found that the perivascular area, the nerves surrounding the small capillaries, are being modulated by tDCS. So we have both tDCS effects on cortex, on the cortical neurons, but also there's a vascular effect of the stimulation, which is being disregarded in the field, but now it's become more known, particularly with this recent review that shows, apart from the neuronal activation, you have the neurons that surrounds the blood vessels in the brain itself that are being modulated. So you have a dilation of blood flow or constriction that is modulated by the stimulation. So what we have is both the traditional neuronal to blood flow increase, but with this neurovascular modulation method, where the stimulation is affecting the blood vessels, you have an increase in blood flow driving neuronal activation. So this is quite a different way to consider how the stimulation is actually working, and NIRS is perfectly positioned as a direct measurement of this neurovascular modulation. So before it was a secondary aspect, but now we can use the NIRS signal as a measurement of the effects of stimulation. So some applications of how tDCS can be used. We did some first experiments on neuromuscular fatigue. So we can use the NIRS signal to determine when somebody has reached a level of fatigue. The work in Montpellier, we looked at how can we see if tDCS can change the efficiency of neurotransmission. So what we're saying here is that when you do a task, let's say finger sequence, whether during stimulation, your level of activation is less, so you're more efficient at doing the task. And we found that the NIRS response was smaller during stimulation. So this would indicate you're more efficient when you're doing tDCS and the task. This was also confirmed in a larger study here in Montpellier, that we find these immediate effects during stimulation plus a delayed effect. I won't go into the detail, but essentially what we find is that there's a rebound which could indicate the concept of neuronal plasticity mechanisms occurring for learning, which is a delayed effect. So NIRS was able to detect this. Some other applications, we used a large star stem system, which allows multi-channel stimulation and EEG measurements with an Artenis bright system that measures up to 27 channels. In this case, we used 8 of these channels. And we looked at providing a random noise stimulation to see if we can enhance the learning effects. And we were able to finally do some analysis on this data, choosing a number of channels in the frontal area and the parietal area to see if the stimulation had effects on the hemodynamic signals, which represents the improvement in performance. And we're currently working on this, and we're finding some interesting results, which should be published soon. We're also using the random noise stimulation method to look at if we can enhance creativity. So here is an Artenis Octomon system that we measured the NIRS during the stimulation and creativity tasks. So the benefit, maybe haven't explained clearly, the benefit of the NIRS is that it's not affected by the electrical currents that would affect the EEG, for example. So NIRS is an optical signal, so that the light traversing through the tissue, while it's not affected by the electric field. So it's more a physiological measurement that we can use to guide stimulation and measure the effects of stimulation. So these are some of the ways that we use to analyze. So during a cognitive task, looking at the NIRS response, so the amplitude of the changes, for example. So the clinical work, I've been focused on stroke rehabilitation and Parkinson's. So we've done some work on using tDCS for Parkinson's patients, using virtual reality games, as well as stroke patients using VR games for paretic arm function improvement. So I'll focus the rest of the talk on this part. So one of the big studies we've been doing here in Montpellier is this REARM project, which we just finished the last patient a few months ago. So we had about 60 patients. One group received tDCS, another group just did the VR sessions over